Hello friends, this is Up to Par MD with Dr. Parfate MD. Today I have sad news to bring you. This is the unexpected death of Dr. Paul Farmer, co-founder and one of the pioneers of the International Public Health Organization Partners. Passed away suddenly in Rwanda, where he was continuing his exhaustive work. He was only 62 years old and survived by his wife, Dr. Didi Bertrand Farmer, and their 3 children. The CEO of Partners in Health, Dr. Sheila Davis, released the following: Paul Farmer's loss is devastating, but his vision for the world will live on through Partners in Health. Paul taught all those around him the power of accompaniment, love for one another, and solidarity. Our deepest sympathies are with his. Dr. Farmer was also a clinical professor at Harvard University Medical School, a professor and chair of the Department of Global Health and Social Medicine there. He was also chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston, in addition to being, as I mentioned, co-founder and chief strategist of Partners in Health. Dr. Farmer certainly talked the talk through his high-level educational instruction, but he also walked the walk, doing his work hands-on around the world. Partners in Health works with local governments in 12 countries around the world, some of the poorest countries in the world, to assist with public health issues there. They're involved in pediatric health, women's maternal health, mental health. They also tackle specific diseases like tuberculosis, HIV, and Ebola, and they also provide basic primary care as well as emergency care in many of these places. They have involvement in the U.S. also. They just in fact started their efforts in the U.S. just in 2020. They're also involved with the Navajo Nation, the native Navajo tribe throughout the United States as well. They're additionally involved with Haiti. In addition to being an extremely poor country, has had natural disasters, including an earthquake that just hit in January. They're also involved with several poor African countries. To this day, it's very sad to know that over 80% of Africa still has not received a single COVID vaccination, while here in the West, we have an overload, a surplus of COVID vaccine, oftentimes having it expire at a particular injection site because there are not enough people to inject. So you're looking at poor countries in Africa like Lesotho and Liberia, Malawi, Sierra Leone, and of course Rwanda, where Dr. Farmer unexpectedly passed away. And it was described as an acute cardiac event that took his life in his sleep. They are also involved in countries like Kazakhstan and Russia even, both of those countries where they have their efforts focused on combating tuberculosis. Additionally, they're involved in the South American country of Peru. So this was truly a legend in the world of global and public health. The good thing that many of us think about, but he was able to do, is he was able to leave a legacy that would carry on even after his death. And that would be the organization that he co-founded, Partners. You know, the work that they do requires not only the physical travel, the physical care, it requires fundraising, it requires education, as he provided at Harvard. It also requires political skills, navigating these countries, quite often with corrupt governments, and still keeping a focus on the poorest of the poor and the sick themselves. Dr. Farmer was also a multiple-time author, having written several books, including Reimagining Global Health, an introduction to Repair the World. Paul Farmer speaks to the next generation. And most recently, he had a book released in November of 2020, Fevers, Feuds, and Diamonds, Ebola and the Ravages of History. And this really tells the tale of recent years in Africa, the country where he did a lot of his work, the country where he just today, February 21st, 2022, unexpectedly passed away. So rest in peace, Dr. Farmer. You will be missed, and please do explore Partners in Health, PIH.org, and consider donating your time, your money, or at least your attention to spread the word about Dr. Farmer's efforts and about this great organization that he left behind. Thank you.